the disease called childhood obesity. This is either through bad eating habits or lack of physical activity, and most of it is due to the parent influence on it. My passion for nutrition and healthy living has made me want to study this disease and how it affects the people with it. My own experience with siblings and other family members who have battled obesity has made me want to study, and I've also done research as to why it should be eliminated. Many of you have probably witnessed children with childhood obesity in your lifetime. Today I will share with you what I have learned about childhood obesity, the cause and effects, and what can be done to prevent it. Now I will explain what it is. Childhood obesity is a preventative disease in which kids ranging from 6 to 11 are overweight due to increased fat content or a BMI over 30%. A large percentage of children, the percentage of children with this disease has tripled over the past 30 years. Usually this is with girls. According to an article titled Nutrition, Physical Activity, and Obesity by the CDC published in 2012, after 2008, more than 1/3 of children were obese. According to an article in the Nutrition Journal by Deacon, Archer, and Dinash, published in 2005, 70% of obese children will be obese adults when they get older. 40% of these children that are obese in North America is over the weight compared to the percentage in other continents. Public health researchers say that the best way to stop this problem is at the source, so mainly educating the kids about healthy eating habits when they're young and teaching them to be physically active. Now we'll explain the causes and how it affects people with this disease and the economy, in which is a major problem. The cause of this excess fat is an imbalance in the input and output of the body. The input basically being the food, output, energy expenditure. According to an article in The Lancet by Han Lawyer and Kim, published in 2010, this disease is also caused by genetic factors in the family that influence the person. In a letter titled Childhood Obesity, Factors Affecting Physical Activity, published in 2006 by Biscotta to the Secretary of State, the family and environment of the affected individual has a great influence on their lifestyle. Children that aren't pushed to join or not even involved in extracurricular activities are more at risk for this disease. Obesity can lead to many long-term and short-term effects. The short-term effects of this disease are high blood pressure, high LDL levels, which is high bad cholesterol, high blood glucose levels, and increased risk of heart disease. The long-term effects are type 2 diabetes due to the increased blood glucose levels, stroke, osteoarthritis, and cardiovascular disease. When children become overweight or obese, they begin the vicious cycle of having healthcare problems and having to deal with the healthcare insurance companies and bills. According to an article from the Journal of Health Economics by Bachara and Boondorf, published in 2009, it states that the average annual medical expenditures are $732 higher for obese employees than they are for normal weight adults. Because obese children are most likely to become obese adults, employers have the responsibility of paying higher health insurance premiums than they would their normal employees. This increased payout becomes the norm in this situation, so therefore because of more obese people in the population. This problem also causes many overweight people to earn less wages if not insured under the company than the thinner employees. Also based on this article by Victoria and Boondorf, obese people on average earn $1.42 less than their thinner employees, and even less than if they are insured, $1.68. Now that you know what childhood obesity is and how it has come to be, Here are tips and solutions to this terrible disease plaguing our youth and our nation. Go to your schools, go to your high schools, and make them make initiatives to change what they're feeding the children. Because most of the time, they don't really care about what they're feeding them. Start eating healthy yourself. If you start now, then when you have a family of your own, they will also eat healthy. Today, I have shared with you what childhood obesity is and how it is developed. I have explained to you the burdens of how it puts burdens on this nation, this economy, and the future leaders who have to deal with the problem in the future. Now that you understand this and the causes, it is now time to become active to reduce this occurrence of this disease. I have sent each of you an email to sign a petition against childhood obesity, and it'll help make initiatives so that they change the menus in schools and help this disease. Our future, our children's future, and their children's future is at stake here. Don't let this be our day.